Thank you for the invitation again to this wonderful, marvelous workshop. Yeah, we're the Health Across Initiative. We're always happy to support this two-day conference. Every time we come here, actually we come out of the box because we, as the name already suggests, we work in healthcare and across the border. But we'd like to invite you now in the next 10 minutes to come into our box and to see what we do actually in cross-border healthcare and with our projects we do. Let me start. So you've spent the last 1.5 days in Lower Austria, and as the map also shows there on the left side, we have a quite long border to both Czechia and more to the east clockwise Slovakia, and then also Hungary. Well, if you hop over Burgenland, but it's quite close, and we have we're by size the second biggest region in Austria, and we also have a big population actually living in a border region. And as healthcare just doesn't only belong to cities, it's also important in the regions, in the rural areas. We care about accessing healthcare facilities in these border regions. Probably most of you already have heard of Health Across, not only because of the banner, because we're always here, but we just wanted to give you a quick overview of what happened in the last 1.5 years in Lower Austria and in the field of health and healthcare. We had very big organizational changes. So the Health Across Initiative, where we belong to, we are now part of the Health Agency of Lower Austria. In German it's called Niederösterreichische Landesgesundheitsagentur. And basically all the hospitals and nursing homes are combined together in one big organization. So we are now an employee of 27,000 employees, and just right next door is the Hospital of Tulln. It's one of our 27 hospitals in Lower Austria, and we also have around 50 nursing homes. All this organization is absolutely big. It's an institution under public law, and basically sometimes we're joking with our European colleagues that we're kind of communists because all the care in Lower Austria comes from one hand, which is in fact true. But of course, you can also see it like that. We are just leveraging all the synergies you can have in management, in purchasing, in quality of health. So we provide health basically from birth until your old age and care. Good. And the Health Across Initiative, what do we do?
Yeah, thanks to Julia. Yeah, I will now give you a short overview about our Health Across Initiative. We are based in the Health Agency of Lower Austria. We are, so to say, Lower Austria's cross-border healthcare unit. And our objectives are relatively easy to explain. We want to improve quality of life for citizens living in the border regions. We want to ensure and to improve equal access to healthcare services, providers, and treatment for everybody. And of course, we also want to generate a positive social and economic impact for both people and the regions. So to put it in a vision, I would say we are pursuing the aim of a common, more united European Union, even in the field of health, especially in the field of healthcare. And yeah, so how do we try to make our vision come true? Our mission can be done by implementing innovative and international projects and by being an active member of both international and European health networks. So, next slide, please. Yeah, currently we are working on the implementation of 4 cross-border projects within the framework of Interreg A, together with partners of the Czech Republic, Slovakia, and Hungary. So Health Across for Future and Gemeinsam Grenzenlos Gesund are our projects we are working on together with partners from Czech Republic. Bridges for Birth is our project with Slovakia, and the Heal Now project is to be implemented together with partners from Hungary. So going a bit more into detail, next slides.
We'll just have a look at all the project, what we do, what our activities are, and in fact, how, because you're from the Netherlands, the Eurigi or Masterrhein, they're also very active in cross-border healthcare, and they're a close partner of ours. Actually, I'd almost call them friends, and we learned a lot from them in our cross-border healthcare activities. And the first and biggest project of ours is the Health Across for Future project, which is situated in the region Gmünd České Velnice. It's quite in the north. It's between Lower Austria and South Bohemia. And there it's a quite special situation because directly on the border there's an Austrian hospital, but if you cross the border to Czechia, people from Czechia couldn't come to Lower Austria for healthcare. And we try now in the last 10 years that they can come to Austria, and we also made it happen. So they can come to our hospital both for inpatient and outpatient treatment. They don't have to pay anything. We care about all the organizational stuff and receive care there. And it's so successful that within the last 4 to 5 years we found this idea that we should actually also build a primary healthcare center at the border, which even improves the healthcare services there more for both Austrians and Czechians. And we got 100% European funding from the Agriculture Fund for this healthcare center. And actually on the 16th of October we're going to open it. So we will open it, and it's a huge success for our cross-border healthcare activities. Then we have the project Gemeinsam Grenzenlos Gesund. It's between Lower Austria and South Moravia, and already today we heard actually about your region, South Moravia, and also about the tornado. And this is also a piece of this project series because back in 2008 we started to initiate a cross-border treaty for emergency services. So back then when you had the tornado, actually Austrian emergency services were able to come to South Moravia and actually help you out. The Red Cross or the UMTC rescue helicopters saved, I think, 2 persons. They got them out of the crisis situation and flew them to Vienna for emergency care treatment, which was quite successful. And just this Monday we had some event at the embassy in Vienna of the Czech Republic, and to basically honor all the members who were part of this emergency service. And as well in this project we see that Lower Austrians can go to the hospital of Znaim for radiotherapy. And doctors from the Znaim hospital came to the hospital of Melk and showed them special treatments in endometriosis, which is a disease of women when they cannot get babies. And they kind of educated our doctors how they can manage with this situation. And I think up to date, I think since 7 years we were already able to, I don't know, have 80 babies out of this educational cooperation, which is quite successful as well. Then we have the project Bridges for Birth, which is between Lower Austria and Slovakia. We have a very small hospital in Hainburg, which is alongside the Danube, and then 80 kilometers away is a huge children's university clinic in Bratislava. And in this project we try that if we have emergencies in newborn babies, that we can transfer them over the border. And it looks quite good. Of course the corona crisis made the situation a little bit more difficult, but we're still quite we think that we can make this work soon. So you will read hopefully about it in a newspaper. And the last project, our newest project.
Yeah, our latest project is the Heal Now project. It's the first real cross-border project between Austria and Hungary in the field of healthcare. And yeah, generally it should lead to establish a long-term and sustainable cooperation in health between these 2 states. And generally there are 3 main work packages. So work package 1 is about building up an hospital cooperation between the Hungarian hospital of Sopron and the Lower Austrian hospital of Neustadt in the field of digital pathology. You can see on the screen an example of how digital pathology could or should look like if we would be able to work with it and to use this technology. And as you can hear, I'm talking a lot about could, should and would. That's the problem in this situation. A few weeks ago, Lower Austria was not able to use this kind of technology, because we don't had any device which was able to digitalize the tissue samples. So that's why we decided to buy some slide scanner for the hospital of Neustadt in order to make it possible that we can start working with this new this new way of digital pathology. And yeah, of course, another very important point in this project is to conclude a bilateral rescue contract between Austria and Hungary. It's very similar to the Bridges for Birth project, in order to be able to improve cooperation in emergency cases between these two countries, and yeah, to be able to improve cooperation for citizens to improve health quality. And yeah, we are now at the end of our project. We both hope that you were not too tired after having lunch and that you were able to follow us. And yeah, thanks for the invitation again. And if there are any questions, please feel free to ask either now or later by email. You can see our contact data here. So thanks.